Hey guys, welcome back to the channel. Recently Justin Bieber announced that he has been suffering from a facial paralysis due to a condition known as Ramsay Hunt Syndrome. So let's have a look at this syndrome in a little more detail. Ramsay Hunt Syndrome has been named after Sir James Ramsay Hunt, an American physician in 1907 described Ramsay Hunt Syndrome, which is a combination of patients suffering from a viral lesion of the ear, face, oral cavity, accompanied by facial palsy and other neurological disturbances. So what is Ramsay Hunt Syndrome? Ramsay Hunt Syndrome, alternatively known as herpes zoster oticus, occurs when a shingles outbreak affects the facial nerve near one of the ears. Ramsay Hunt Syndrome, in addition to the painful shingles rash, can cause facial paralysis and hearing loss in the affected ear. The same virus that causes chickenpox causes Ramsay Hunt Syndrome. The virus remains in your nerves even after the chickenpox has healed and may reactivate years later. When this happens, it can affect one of the cranial nerves, in particular cranial nerve number 7 and cranial nerve number 8, which can lead to auditory disturbances and facial nerve palsy. The treatment of Ramsay Hunt Syndrome should be proceeded as soon as possible, and this can reduce the risk of complications, which can include permanent facial weakness and deafness. So what are the symptoms of Ramsay Hunt Syndrome? Well, there are two main signs and symptoms: a painful rash with fluid-filled blisters and vesicles on or in around one of the ear, accompanied by facial paralysis or weakness on the same side as the affected ear. Typically, the rash and facial paralysis occurs concurrently. Sometimes one can occur before the other. Sometimes the rash never appears. Patients can also suffer with the following symptoms. They can have an earache. They can have hearing impairment. Their ears may feel like they are ringing, tinnitus. They could have difficulty closing one eye, a spinning or moving sensation, vertigo, a change in taste perception or taste loss, and could have a sensation of dry mouth and dry eyes. So which cranial nerves can be affected? The varicella zoster virus affects the geniculate ganglion of the cranial nerve 7, which supplies the muscles of facial expression. But it can also affect cranial nerve number 8, as we've mentioned before, which can lead to auditory and balance issues. Very rarely, it can also affect other cranial nerves, including cranial nerve number 3, 4, 5, 6, 9, 10, 11, and 12. How does one get Ramsay Hunt Syndrome? Who is afflicted with Ramsay Hunt Syndrome? Well, Ramsay Hunt Syndrome occurs in people who have previously had chickenpox, and the virus responsible for that is the varicella virus. Ramsay Hunt Syndrome is extremely rare, with an estimated incidence of 5 per 100,000 people. Females are slightly more likely to be affected than males. Ramsay Hunt Syndrome is most common in adults, particularly those over the age of 60, but it can also occur in children on rare occasions. Ramsay Hunt Syndrome is responsible for approximately 12% of peripheral facial nerve palsies. The second most common cause of non-traumatic peripheral facial nerve paralysis is Ramsay Hunt Syndrome. So what are the risk factors? Well, what causes a reactivation of the varicella zoster virus? And this can be due to several reasons. It could be due to immunodeficiency, such as HIV or cancer. It could be due to patients receiving immunosuppressive therapy, high levels of steroids, chemotherapy or radiation therapy, or individuals who are severely ill or malnourished and under extreme physical and emotional duress. What is the long-term prognosis of Ramsay Hunt Syndrome? Ramsay Hunt Syndrome has a worse prognosis than Bell's palsy, which is specifically a cranial nerve 7 palsy, which means that a full recovery is less likely, especially if antiviral treatment is not started within 72 hours of the onset of symptoms. The House-Brackman scale, which correlates with the degree of facial nerve dysfunction, can be used to predict the prognosis. So the following are poor prognostic factors. If a patient is diabetic and is above the age of 60, patient has hypertension and has vertigo, Some of the complications that can occur of facial nerve palsy or Ramsay Hunt Syndrome can be facial paralysis for life. Full recovery is more likely to occur. Patients may also require corticosteroid therapy, analgesics, high levels of antiviral drugs. They may require ice packs. They may require a patch to cover their eye to prevent corneal irritation. The drier eyes may also require artificial tears and lubricating ointments. Well, thank you very much for watching the video. If you found it useful, please kindly like and subscribe to the channel and comment below. Thank you very much again. Bye.